You may well know with a lot of the TV coverage by people like John Kerwin, who's been talking a lot about depression, that things like depression and anxiety are really common. It's not really just something that a small proportion of the population struggle with. In fact, it touches a lot of our lives. And when you have something like a heart attack, because of the big change in the adjustments that go on, you can be more at risk of struggling with something like depression or anxiety. Thinking about depression tends to be that feeling, that experience of being really down, of feeling lack of energy. People often will say that they don't have any hope for things getting better. So people often feel very low and very blue, and they tend to feel that way most of the time. The other thing that happens for a lot of people when they're depressed is they lose interest in things that they would normally enjoy. What we know is that if you get help for depression early, then you can get back on top of it and get back into life. And so what I say to people is, if you've been feeling this way and a couple of weeks have gone past and it's not getting better, instead of just hoping it will get better, and it may, is to go and see your doctor or speak to a healthcare professional about getting some support with that. There's also a link that we've included called depression.org, and that has some fabulous resources around seeing if you're depressed, and by a self-test, and also some resources to support you with depression and managing it. So it's not something you have to just kind of hope you kind of figure out on your own. Really do encourage that you get help. The other common problem that people have, not just when they've had a heart attack, but people again tend to be a little bit more at risk of struggling with it, is anxiety. And there's two kinds of anxiety that I think a lot of people find difficult. One is around just general worry. And we all know some people tend to worry more than others. Having had something major happen with your health is a time where probably you're going to be worrying more. And if you find again that you're worrying a lot and you don't feel like you're managing it, again, talk to a healthcare professional, because oftentimes with the right kind of help, you can get on top of those worries and again get back to living. The other thing I want to give, a special mention to is panic or panic attacks. Now, panic attacks are like a really intense kind of fear, and often people will say it's like a wave of fear that rushes over them, and there's a lot of physical symptoms that go with that. One of the main ones is a racing heart. So the heart races. People often find that their breathing is affected. They get sweaty, they get clammy, they might feel lightheaded. And those are all natural consequences of adrenaline rushing through the body. And adrenaline will rush through the body if we suddenly feel very scared about something. For people who've had a heart attack, who for some reason notice that their heart is beating a bit faster, it's quite easy to then become really concerned about it and to fear that maybe it's another heart attack. When that happens, your brain, your body releases a whole pile of adrenaline, and all those changes that I talked about start to happen. And if you think about one of those changes being a racing heart, what do you think happens when you start worrying about what that racing heart will mean? Your heart rate's going to go up even further. So then you can start to think, well, this really is a heart attack, which again is going to release more adrenaline and make your heart race faster. So for some people, what happens is they start to get really, really scared that they're having another heart attack, when in fact what it is actually panic. I think the best advice that I can give to people if they find they're getting panicky feelings and it's tied to kind of sensations that they're feeling in their body, worrying that something dangerous is happening, is to do some daily relaxation. So go to the relaxation part of the site and do some relaxation, preferably twice a day if you can. That will really help reduce your overall levels of tension. The other thing is, if you have these strange symptoms that you're worried about, go and get them checked out. Whether it's a trip to your GP or if you're really concerned and you do end up going to the emergency department, you will learn something. If it's something serious, then fabulous, you've got attention there to help with it. If it is just a normal niggle, the normal changes in the heart when you're exercising or whatever you were doing, then you've also learnt that that is what's normal for you.